Cannot spread from one patient to another patient like you said in COVID. Blurring of vision or redness of the eye, even in the 20s. But this year we are seeing almost 3 cases per day. It's about 5 to 6 lakhs of just antifungal treatment. I'm Dr. Satish Nair. I'm an ENT and head and neck surgeon at Apollo Hospitals, Banagata Road, Bangalore. Black fungus, as we say, it's a fungus that is there in most of the places on the earth. It's there in the earth, it's there in the soil, it's there in manure, it's there in lots of places. So this has been ubiquitous, like I say, it's always there around us. There are various fungus in the environment, like the Candida, the Aspergillus, and the Mucor. So Mucor, a particular type of fungus that is generally present in most of the places, like in the dust, in the sand, and the earth. It's been always been present all around us. So this fungus does not cause an infection to a person because the person has the immunity to prevent this fungus to cause any infection. And if this fungus causes infection, it usually results in loss of blood supply into that area. So typically those areas become dark, or we call dark eschars, and that's why it's called the black fungus. You are a post-COVID person, you have gone through these treatments, you're a diabetic, you are immunocompromised, you're a post-cancer treatment patient, you're a patient who has had a transplant or something like that. So you're an immunocompromised patient, or even a patient who's a diabetic post-COVID, and you have been on steroids. After this, the next thing is you're talking about this patient, getting some kind of symptom. If there's a nasal block in one side, nasal block, or discharge, or there's some kind of, heaviness in that side of the cheek. The other thing, one of the common things is to have, loss of sensation of the cheek. A lot of people will develop because the nerves here are affected, or the teeth falling off, that way. It can also lead to next level, we could say, is, some amount of blurring of vision or redness of the eye, swelling of the eyelids. But then by the time it's already from the sinus, it's almost started affecting the eye. Mucormycosis is not a contagious. It cannot spread from one patient to another patient, like you said in COVID. I've been talking to my colleagues in the other hospitals. They have seen patients even in the 20s. But usually we are finding patients in the age of 50 to 70, above 50 and the further that way. So the treatment has always been the same. We call it debridement. That means go and remove as much of the disease as possible in whatever area is involved. So if it is sinus, the sinus disease is removed. If it involves the maxilla or the bone part is removed. If it involves the eye, depends on the vision present or not present, if required to remove the eye or not. And so it's about removing the disease, like cleaning up as much as possible. We call it debridement. So that is the first part of it. So then what happens is, after we remove it, we can use an antifungal that is against this fungus. So if only little disease left, most of it is removed, then the antifungal comes into effect. So the most useful antifungal, or the one that has been preferable, or we say the best treatment for it, is called liposomal amphotericin. Before the COVID, we would have maybe even a tertiary care hospital 1 case or 2 cases a year. In a severe diabetic patient, ketoacidosis, immunocompromised patient, very rare. Even maybe in a government hospital, maybe you may have few more cases in a year. That's all. And like we would treat them with surgery and followed by amphotericin. In the last wave, that's the last year, we would say, after COVID, maybe we had about 3 to 4 or 5 cases. Other hospitals may have 10 to 15 cases. But this year we are seeing almost 3 cases per day. A drug called amphotericin, which is so rarely required, was in such low production levels. And today we need it in such high levels. And the number of vials that you require for each patient. So the requirement of it is so high, the production has never been so high to cater for this. So that is why we do definitely have, a shortage of this medicine as of today. If 50 milligram vial is about 7 to 8,000, and we require about 4 grams to be given, and about 80 vials. So you can easily calculate it's about 5 to 6 lakhs of just antifungal treatment. So the treatment is also expensive, not just about the surgery, the admission, if required ICU, if required, ventilator for these patients, and also the post-COVID effects and their treatment. So this is an additional thing, and this use of amphotericin and its cost is also very high. And the prevention can be done as what? We should know what are the things that is leading to it. So an indiscriminate use of maybe steroids maybe is one of the things that we should look at. But then at the stage of COVID, we are all thinking about our lungs and we're trying to breathe. So everybody is taking a lot of steroids. Maybe the glycemic control, that is the sugar control during this treatment, should be, a strict control should be there. So the blood sugar levels are not very high. And then a high degree of suspicion and, early coming and evaluating yourself with a ENT specialist to identify this condition is what I would say is required.